from the prospectus prepared using the information you will listen to in this video. If it is useful for your video, don't forget to like the video and subscribe to the channel for support. Zyban, a drug from the antidepressants group, is offered in 150 mg tablets. The active ingredient of Zyban is bupropion. What is Zyban? What does it do? This medication is used in combination with a stop smoking program to help you quit smoking. Bupropion can decrease your nicotine withdrawal symptoms and your urge to smoke. Quitting smoking decreases your risk of heart and lung disease, as well as cancer. How to use Zyban? You should use these medications exactly as they were prescribed for you. Take this medication by mouth with or without food as directed by your doctor, usually twice daily. If stomach upset occurs, take with food. It is important to take your doses at least 8 hours apart or as directed by your doctor to decrease your risk of seizure. You may have trouble sleeping when you start taking this drug. Do not take your evening dose too close to bedtime. Swallow the tablets whole. Do not crush or chew the tablets. Doing so can release all of the drug at once, increasing the risk of side effects. The dosage is based on your medical condition and response to treatment. Your dose may be slowly increased to limit side effects. Do not take more or less medication or take it more frequently than prescribed. Taking more than the recommended dose of bupropion may increase your risk of having a seizure. It is recommended that you do not try to quit smoking until you have been taking bupropion for 1 week so that the drug can reach a high enough level in your blood. Set a date for quitting, and stop smoking sometime in the 2nd week of taking the drug. If necessary, this medication may be combined with nicotine patches or gum to help you quit smoking. The combination of nicotine and this medication may increase your blood pressure. Your doctor may need to monitor your blood pressure closely. Do not smoke at any time if using any nicotine products with this drug. Too much nicotine can cause serious side effects. Use this medication regularly in order to get the most benefit from it. To help you remember, use it at the same times each day. Precautions to be followed before using Zyban. Before taking bupropion, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This medication should not be used if you are suddenly stopping regular use of sedatives, drugs used to treat seizures, or alcohol. Doing so may increase your risk of seizures. This drug may make you dizzy or drowsy or blur your vision. Alcohol or marijuana can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness or clear vision until you can do it safely. Avoid alcoholic beverages. Older adults may be more sensitive to the side effects of this drug, especially dizziness and memory loss. Dizziness can increase the risk of falling. During pregnancy, this medication should be used only when clearly needed. Behavioral therapy and stop smoking education is preferred for pregnant women who desire to stop smoking. Discuss the risks and benefits with your doctor. This drug passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. What are side effects of Zyban? Common side effects of Zyban include agitation, dry mouth, insomnia, headache, dizziness, nausea, stomach pain, constipation, tremor, insomnia, weight loss or gain, changes in appetite, ringing in your ears, loss of interest in sex, sore throat, muscle pain, itching or skin rash, increased sweating, or increased urination. Dry mouth and trouble sleeping may occur as your body gets used to the drug. Dizziness, drowsiness, nausea, diarrhea, fatigue, constipation, blurred vision, increased sweating, strange taste in mouth, or stomach pain may also occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If this video was useful for you, for support, like the video and subscribe to the channel. Share your views and experiences in the comments section. I wish you healthy days.